Many of today's medical practices view revenue cycle management as the route between the physician work and billing to timely payments. Typically, this process is measured by the average days it takes to get a claim paid. At ProCare Pain Solutions, we see this as a much longer and more complex process. We feel that an effective revenue cycle management system needs to have measurements in place for every touch point within this process, beginning with the patient registration and appointment scheduling, all the way through the collection of that final payment. So the question that becomes is, how do you manage all of these touch points? To us, a successful revenue cycle begins with education. It's vital to educate your team, your clinicians, and your referral sources regarding their role in the revenue cycle process. For instance, how well do you inform the doctors that refer to you on what your practice provides or how they can help set patient expectations for their visit to your office? Educated referral sources set the stage for more informed patients, which in turn will reduce the cancellations or no-shows and drastically improve your collections. How well are you educating your own providers? Providers need to be up to speed with all the changes in coding, how to properly use the EMR, and the consequences for not submitting charges on a timely basis. Do you have a plan in place for educating your providers? Finally, equally as important as educating your referral sources and providers is educating your support staff. Your team needs to understand the role that they each play in the revenue cycle. Things such as the importance of collecting accurate patient demographics, verification of insurance benefits, accurate charge entry, and visit reconciliation. Clinical support staff also play a role in this process by appropriately coordinating care for patients for testing and follow-up and getting things such as medications authorized appropriately. Training for everyone needs to be in place on how to minimize input errors as well as how to effectively communicate with patients about possible out-of-pocket expenses that they may have and the best ways to collect money from patients. All these touch points are separate yet connected and all need specific measurables or key performance indicators. A successful revenue cycle process is more than just knowing your days in AR. A well-organized revenue cycle system has everyone working at the top of their license or assigned duties. During our next vlog, we'll discuss some of the KPIs that we use and why.